Hello, my name is Dr. Adam Zanbilovich, Dr. Z, and I'm the podiatrist at the Brickyard Medical Clinic in Nanaimo. Thank you for taking the time to watch my video. I want to begin by telling you why I've created this slide presentation. In my early career, I spent a lot of time in the operating room dealing with the consequences of poorly controlled diabetes. I'm talking about the amputations, and I'm talking about all of those terrible things that can happen. And one of the things I realized very quickly is that most of those things could have been avoided if the patient had a better understanding of their disease process and had been more involved in the care and the management of their diabetes. So I began doing a lot of teaching, and it quickly became obvious to me there that most of the patients who were coming to learn about diabetes had already been through training programs and had actually become overwhelmed with tremendous amounts of information, and then after being overwhelmed had been told all of these horror stories. I'm not going to do that. We are way beyond that in our understanding of how diabetes works. And I believe that if you understand the big picture of how diabetes works, that it all makes sense. So diabetes, for the vast majority of people, with advances in new medications and strategies to take care of it, diabetes now can be nothing more than an inconvenience. And that's the truth for the vast majority of patients. In the most cases, diabetes is something that you can control, you can be the boss of, and the big way that you know that you're succeeding in the management is by watching your hemoglobin A1c. Now, if you know what your hemoglobin A1c is, if you know how one measures the A1c and why it is such an important test, that's the big focus of this whole talk. That is the only fact that I'm going to try and teach in this discussion, because I think understanding that leads to an understanding of all of diabetes. If this seems reasonable, if you already know about your A1c, go out, go do something fun. Otherwise, probably best if you stick with me for just a little bit longer. So I often get a lot of people who are asking about their diabetes, and one of their concerns is that they don't want to prolong a poor quality end of life period. And it turns out that's the exact reason that we want to control diabetes. It turns out that in patients who have poorly controlled diabetes, the diabetes slices away at quality of life very, very slowly. You lose multiple subtle bits of organ function very slowly. You lose vision, you lose sense of touch, you lose kidney function, and it is a terrible, terrible way to spend the last years of your life. People who have early and good control of their diabetes really don't run into those problems. The way that I want to go at the end of my life, without any question, is I want to go suddenly with everything falling apart all at once. Diabetes doesn't let you end your life that way. For the most part, it ends up being a very slow process that we can now avoid altogether for the vast majority of diabetics. So fundamentally, diabetes is about sugar. You can look at it in many more complex ways, that there are tons and tons of other chemicals, but at the end of the day, what's really happening is the sugar is blocking things, and the things that it blocks are no longer functioning. The higher your sugar, the faster it's blocking things. If you're a diabetic with outrageously high sugar, it'll get you right away that night. If you're a diabetic who's just averaging higher sugar than they should, it may get you by the time you're 60 or 70 or 80. If you're a person who's not diabetic, or a person who's really controlling their sugar very well, the sugar that's floating in your blood won't be you're 200 years old, and I'm pretty sure something else will have got you by then. So fundamentally, the sugar that causes the damage to you is the sugar that's in your blood, which is causing coatings and blocking up those tubes, those straws, and it's turning your blood vessels into sugar-coated straws. Again, it's a little more complex. Cholesterol's involved, inflammation is involved, but at the end of the day, the sugar is one of the big steps that is causing blockages of blood vessels. So here's a picture of a really big blood vessel coming right off your heart. So that's supposed to be the aorta. And as I was saying, over your lifetime, the sugar is going to start blocking that up. Over many, many years, or fewer years if your sugar is very, very high, it's going to create that yellow layer of coating. Now, on a big blood vessel like this, the sugar is still able to the blood is still able to make it through that blood vessel. However, if you look at that same sugar coating process on a smaller blood, it's much more dramatic in how it blocks things up. And if you imagined a blood vessel even smaller than the one on the right, it would be completely blocked off. So if you understand that that's what's going on, then you should ask yourself, well, where in our body do we have these really tiny blood vessels? And the places we have them are at the branching of a tree. So we have them at the very end, we've got them in our feet. That's why podiatrists are so involved in diabetes care. We've got them in our kidneys, tons of little tubes and pipes that are involved in filtering things out. We've got them in the back of our eye. That's why diabetics are always getting their eyes checked. And we also have them surrounding our nerves. Neuropathy is a term that I'm sure most diabetics have come across at some point. It just means bad nerves. But the badness that goes on in the nerves, the nerve malfunctioning is probably to a large degree caused by those little teeny tiny basket weave of blood vessels that are wrapped around nerves. So, how do we manage this? How do we know that we're controlling the diabetes? And so this is where we're going to get into what the A1c is, the hemoglobin A1c. Well, it turns out that your blood is basically sugar water. And it turns out that while the blood is the sugar in the blood is coating your arteries, it's also coating the things floating inside your blood. And one of those things is the blood cells, and one of those blood cells is called a hemoglobin blood cell. And over time, you can really imagine, and it's a really very good analogy to imagine those hemoglobin blood cells getting sugar coated and turning into Smarties. Now, the higher your sugar, the faster those blood cells are turning into Smarties, and that thicker and thicker and thicker the is getting. Now, one of the interesting things is that we get a brand new set of blood cells every 3 months. And what that means is that we can actually measure what your average sugar has been over the past 3 months if we measure how thick that sugar coating is. We don't simply take a ruler and hold it up to the blood cells and measure how thick it is. That would be quite difficult, I don't think, and very tedious as well. Instead, for practical reasons, what actually happens is the blood cells get mashed up into a tube, and then we measure what % of the mash is sugar. So that's why when you get your hemoglobin A1c from the lab, when you get your own lab results, which you should be doing, you'll see that the hemoglobin A1c is reported as a %, which is different than the way that one reports your random blood sugar from a finger prick. And what it's measuring is what % of the mash is sugar. And it turns out that if that mash is sugar, then you're doing everything right, and fundamentally the sugar coating process is happening so slowly that something else will get you first. When I was in medical school, we really didn't know how low was low enough, and we were actually there were a number of studies that came out that were suggesting that we should be checking sugar at every possible opportunity all day long to get people as low as possible without putting them into a coma. And unfortunately, sometimes we actually would put people into comas as we were trying to get it so low. So we now know that you don't have to be, that there is a threshold, and you don't need to do more than that 7%, 6.5% if you're very young or very picky. So if your A1c is 7%, your diabetes is fundamentally not damaging you. And you don't need to feel guilt or stressed about anything. Your diabetes is under control, and you can move on and work on something else. I just want to spend one moment clarifying something, because I think it's something that people do get confused about, which is the difference between the finger prick and the hemoglobin A1c. The finger prick is measuring how much sugar there is sitting in your blood at this very second. It is not telling you what your future risks are. It tells you where you are right now. The finger prick is a very important thing in emergency situations. It's very important if you're worried that your sugar is suddenly too high or suddenly too low. You need to have that information. You need the finger prick. The finger prick is also very important to be used as a tool to report to your endocrinologist or your family doctor how your sugar is changing throughout the day. And that's really important if your sugar is not being very well controlled. So if you have half a banana, you'll get a sense how much that affects you. If you wake up in the morning and your sugar is very high or very low, those are also useful information that's going to help your doctor figure out strategies that are then going to be useful to help control your diabetes. The hemoglobin A1c tells you nothing about what's happening right now. It's telling you what the average is for the past 3 months. You can't fake out your hemoglobin A1c when you go for your blood test that morning, whereas you could certainly fake out your finger prick one way or the other. So interestingly, there was a study a while ago where they took people and they monitored their blood sugar every minute of the day, 24 hours a day, 7 days a week for a full 3-month period. And they measured their A1c after that period, and they also measured their finger prick averages. And it turns out you can actually convert from your hemoglobin A1c into your random blood sugar finger prick values. And it turns out that a 7% A1c matches up with an 8.5 millimoles per liter of sugar, which is quite a surprising thing for many people. And the reason that people are often surprised that their A1c of 7 matches with an 8.5 is it's testing at what's happening 24 hours a day. It's including in the middle of the night and at the little peaks that you may not be testing during. So the big thing is you're the boss of your diabetes. If you've got the A1c under control, you're doing everything right. And there are some wonderful new medications out there. There are some 24-hour insulins. It's a single injection which has dramatic effects on many people. It allows them to take over and control a lot of their own sugar control. There are new medications that actually encourage the kidneys to allow you to release more urine. So you actually are not more urine, excuse me. Allow you to pee out extra sugar, and by peeing out the sugar you're actually losing weight and you're controlling your sugar. So there's some wonderful new medications, certainly worth talking about with your doctor. And the big thing is, if you understand what the A1c is and your A1c is 7, you can really take a sigh of relief and know that your diabetes is well under control and you're doing everything right. Thanks so much for listening. If you'd like to book an appointment, I'm more than happy to go over your individual case at any time. And again, thank you for your time.